secondary benefit of Children's Hospital to the economics of the state. I don't know if you can see this map, but it depicts the 13 other locations where we have our satellites, where we have subspecialty clinics. We have a program inside Parker Hospital, inpatient beds and an emergency room. We have an inpatient program and emergency room at St. Joseph Hospital, and then clinics all over the region. There was concern when we first moved to this campus that we were leaving Denver. Of course, we're only 7 miles. We didn't really leave Denver, but we're outside the city. We spent several $1 million renovating space inside St. Joe's Hospital, where we put our physicians and our nursing staff, and we have clinical operations in St. Joe. So we're still treating patients from within the city limits of Denver. In our educational mission, I just threw 3 of them. We have 90 residents. These are our chief residents. A little bit about their background. We get residents. These are people who've gone through college, go through medical school, and then they do a 3-year residency in pediatrics. If they want to specialize, cardiology, neurology, and they want to go into surgical service, there's an additional training over and above their residency. So many of these folks are in their 30s before they go out and start practicing. So it's a tremendous amount of training. These are our chief residents this year. You can see they come from, these 3 are from West, but we get residents from all over the country. This is a very sought after place for that level of education. In 2008, there were 436 different nursing students that came through here and over 38,000 hours of clinical instruction. And these are some of the participating schools of nursing. We really have relationships with many, many schools of nursing. These are the ones that send us the most students. As I mentioned, 67% of the Colorado practicing pediatricians receive some form of training here. In the research agenda, we're very proud of this statistic. The NIH is the National Institute of Health. This is where the federal dollars for research come from, and it's very, very competitive. In fact, over the last, until recent administration, dollars for NIH research have been cut, and so it became even more competitive. And as you can see, the University of Colorado Health Science Center, School of Medicine, parenthetically Department of Pediatrics, ranked #1 in the country, and this just was announced a few weeks ago. $42 million in 1 year of research. Our goal for the next 5 years is to double that amount. The faster we do that research, the more we can accelerate discovery, the sooner we'll find cures for pediatric disease. In our advocacy, again, trying to keep children well and not have illness, not be injured, there's a tremendous amount of work. So this ranges from advocating for car seats, use of car seats, helmets, whatever we can do to keep kids safe and out of harm's way. Let's get that go later. These are some examples of some of the quality work we're doing. If a child is sick enough to be in a hospital, we want this to be the absolute safest place in the country for them to be. And so we spend a tremendous amount of time. We have dozens of people working day in, day out on how can we be safer and provide a higher quality. One of the greatest risks for any hospital, whether you're an adult or a child, one of the greatest risks that we all face being hospitalized is for infection. Infections can be prevented by washing our hands and being careful about technique. But there's still, you read about it, how many people get readmitted or have extra costs. About 8% of infections result in death. It's something that we want to try and prevent. So this is an example of some of the work that we're doing on bloodstream infections in the pediatric intensive care unit. We're participating in a national collaborative. And nationally, those of us in this collaborative have reduced infections in children by 40%. And so it's a tremendous effort. When we see these kinds of spikes, what I'm trying to do is make sure it's a flat line, because spikes mean there's variation. So we're really good 1 month, and we have an infection the next month. So we still have work to do to standardize, but the rate has come way down. It's dropped 40%. Just to, you know who's who, the person on the left is the surgeon-in-chief. The child on the right is a patient. This is Dr. Boyd Ziegler, who's our surgeon-in-chief, who's been here for about 6 years. People who work at children's hospitals, be they physicians, nurses, chaplains, are very special. I've got a bias. I think people in healthcare are compassionate and passionate about what they do. People who work in children's hospitals, I think, are the cream of the crop, because they're committing their careers to improving the health of children. And Of all ages. So we have the young residents who are coming out of medical school in their 20s to our senior faculty, all who share a passion for kids and families. I did this very quickly because I wanted to save time for questions, so hopefully you'll have a few for me. So I'll open the floor now for whatever you have on your mind. Yes, sir.
Would you share with us by percentage grouping the medical specialties, like cancer and childbirth and heart and
We have about 50 specialties, different types of clinics and specialty divisions. About 2/3 of those are medical specialties and about 1/3 are surgical. And so it can range from neurology, nephrology, ENT, orthopedics, general surgery. There's a whole gamut. Anything that a child can get in trouble with, we have a specialist for. Yes?
I just wanted to comment that in the late 60s, early 70s, I was involved with the Board of Regents in negotiating an affiliation and moving Children's Hospital down across from the medical school on the west side of Colorado Boulevard. I think it's wise you moved.
Thank you. Thank you for your wisdom. The Children's Hospital is 100 years old, but our relationship with the university is only about 17 years old. And so before that, we were a community hospital, and the teaching and the academic part of pediatrics was at the university. And I think it was a very wise decision. If you look at the best children's hospitals in the country, they are all affiliated with academic medical centers. And so this hospital has really taken off, as has the Department of Pediatrics, because of this relationship. And our board, this precedes my arrival, so I have to take my hat off to the board and to the university leadership. Bringing Children's Hospital to this campus, I think it is a wonderful national model, because the closer we bring our respective physicians together, the faster we can accelerate discovery of new treatments, new protocols, new cures. Is a tremendous opportunity for us, for our physicians to collaborate. It's one of the things that drew me from Nashville. I'm a native Nashvilleian, third generation. My mother was born at Vanderbilt University. And so I was working at Vanderbilt as their first CEO of the Children's Hospital. And so to lure me from Nashville, there's only one place in the country that could do that, and that was here. And it was being a part of this campus and this medical center that I think is leading the country in the advancement of pediatrics. One of the things that we're working on now, because of the proximity, is maternal fetal medicine. We've got a very, very excellent high-risk program at the university. Technology is now allowing us to diagnose problems in children in utero. We don't have OB yet in this hospital, but we delivered 4 babies last year. These were children that had congenital heart defect. Until we were able to diagnose these in utero, these children would be born, and we wouldn't know until they were born. And many of those children died because the heart has a defect that didn't allow it to pump blood through the child's body. They survived in utero because they were attached to the umbilical cord, but once that cord was cut, they couldn't circulate blood, and they died. Now we can diagnose that in utero with ultrasound. We can bring that mom into Children's Hospital, deliver the baby, and take that baby, that newborn, straight to the operating room and provide a surgical procedure. So we're now working with the university and the university hospital to move the OB service to this campus and consolidate the OB and our service, newborn service, together. And that's taking advantage of the expertise that we have at the university and at Children's Hospital. And it will benefit hundreds of thousands of children. And we think that'll be a benefit not only to Denver and to this region, but it'll become a national referral center.
Do you have on staff to take care of all those children? And are you allowing any practicing physician to admit the baby in the hospital and do the treatment of those children? And what's your, how do you go about funding all those expenses that you have?
3 very good questions. First, we have an open medical staff, so most of the specialists who do all of this work are University of Colorado School of Medicine faculty. Any community physician who demonstrates the training and the credentials to take care of children also have the opportunity to be on our staff. And so we have 200 physicians from the community who do have admitting privileges here. This is very expensive. 42% of our patients are in the Medicaid program. Medicaid pays